Bismillahirrahmanirrahim. Assalamu alaikum, students. Today we will be discussing a unique topic in endocrinology, uh, that is diagnostic tests, which are used to diagnose hormone disorders. Students, these are very simple and the appearance looks very horrifying. That is number one, hormone level test, imaging techniques, suppression tests, stimulation tests, nuclear medicine tests. There are antibodies tests. So there are 6 different varieties of different diagnostic tests which are used in the field of medicine and endocrinology for diagnosing endocrine disorders. Let's discuss these laboratory tests and imaging techniques one by one. First of all, students, we have got hormone levels check. The hormone levels are checked in blood and urine. The blood test, for example, thyroid function test. Thyroid function tests are used to diagnose thyroid gland disorders. Then we have got urine test. In urine, the level of catecholamines and metanephrines are used to diagnose pheochromocytoma, which is a tumor of adrenal medulla. Then we have got stimulation tests. Students, stimulation test, for example, ACTH stimulation test, adrenocorticotropic hormone stimulation test. In this test, adrenal gland function is evaluated. Synthetic ACTH is injected and blood cortisol levels are measured. In case of adrenal insufficiency, there is no increase in cortisol levels. And if there is no disorder, in normal cases, cortisol level will be increased. This is used for diagnosing Addison's disease. Then students, we have got growth hormone stimulation tests. In the same way as we have done in ACTH stimulation test, in growth hormone stimulation test, insulin or arginine is used to stimulate growth hormone secretion. In deficiency of growth hormone, growth hormone cases, there is no rise of growth hormone levels after injection of insulin. Then we have got suppression tests. In suppression tests, we assess excess hormone levels. For example, dexamethasone suppression test. In this test, steroids, that is dexamethasone, is used and cortisol levels are measured. In normal cases, the cortisol secretion decreases after dose of dexamethasone. Students, this test is commonly used for the diagnosis of Cushing's syndrome. Then we have got certain imaging techniques like ultrasound. As you all know, ultrasound is used for diagnosing thyroid nodules, thyroid goiter. Then we have got nuclear medicine scan, radioisotope, iodine uptake test for assessing the functional status of thyroid gland. Then we have got antibody test. Student, these antibody tests are used to assess autoimmune disorders. For example, in Graves' disease, autoimmune thyroiditis, TSH receptor antibodies level are assessed. Then we have got Hashimoto's thyroiditis. In this case, anti-thyroglobulin antibodies are detected for the presence of Hashimoto's thyroiditis. And at the end, genetic testing. Genetic testing, for example, congenital adrenal hyperplasia, multiple endocrine neoplasia. In this case, in multiple endocrine neoplasia, students, MEN gene mutation is detected. That is, mutated gene is detected, and multiple endocrine neoplasia is diagnosed. So this was very brief about different diagnostic tests which are used in the field of endocrinology. Thank you, students. Allah Hafiz.